this is Dr. Tazina, one of the consultant dietitians here in the United Kingdom. So we brought together today a very big event, which was highly neat. And the attendees today are around 420, as I can see, which is a big number. It seems like most of you wanted to know about most of the topics in the event, and a lot of you wanted to know about PLAB, IELTS, and foundation training. That was around between 11.5 to 9.3%, but overall, all of you, around 65%, wanted to know most of it. In terms of medicine and surgery, I think the scale went up. Around 33% of you wanted to know about medicine training, and 27% wanted to know about the surgical training. So the day would run through. We'll start with, there'll be a few changes, but however, we'll start with how you get into UK and how you get registered, PLAB, and what is the foundation training and what it entails, how we move on towards GP training, and the other route is the IMT training. We'll also be talking about uncoupled training and the run-through training as well, and also a bit about the Caesar post, because I think that's important. We'll be in the day. There will also be a guest speaker, and the guest speaker will be talking about basically your scope in UK, and a few questions that I put forward for him. So I think that will be very handy for a lot of you, because these are the questions that I think a lot of you would be wondering about, and they should answer most of your questions. The recording would be available. If any of you have questions, the speakers will be leaving their email addresses, but you can also send us the feedback, and we will be sending it to you, and we'll create a feedback document that could be available for all. Right, before we start, should we start over with a small video, which is just going to summarize the training route within the United Kingdom, and it also tells us what are we going to do today. Right. Hello. So let's start with our first topic of the day. It's about PLAB and IELTS and also the GP training and also how to get into GMC. So how to get registered to GMC. So the talk will be given by Mahwish Munawar. She's a GPST in emergency medicine at Calderdale Hospital. And she is a trainee rep within Yorkshire. She's also an IMG rep for the GP trainees, and she has done a fundamental job in PLABable and is one of the content contributors. So she'll be talking about this is something that we didn't know when we started in UK, and this was information literally scattered. We've got it all together for all of you. So over to you, Mahwish.
Everyone. My name is Mahwish. I'm one of the GPST trainee in emergency medicine, and I work in Calderdale Royal Hospital. Today, we're just going to go through, give a kickstart to how the pathway of the UK starts in the UK. As most of you know, that the roadmap, if you look at it, it always good to prepare your visa preparation and how it goes with your registration. Always have a right plan when you're starting with all the stuff. The first hurdle many IMGs which goes through is the IELTS, the English test. There's a lot of information, there's a lot of stuff available online, which I'm not going to go through just specifying on the English test. But just looking at it, that is really, really important, that because you overall in the IELTS exam, you need a 7.5 overall and minimum of 7 for all the 4 language skills. But now GMC is also accepting another exam, which is called not replace, it's your choice. Actually, you can give IELTS, you can give OET, which is much lighter, I would say, less difficult than an IELTS to go through. So many of the candidates are opting for that as well. That is one option to look at. But basically, we're looking at the PLAB, which is actually one of the professional and linguistic assessment board exam through which you actually enter into the UK system, which is a National Health Services. This exam covers all the acute medical conditions, nothing new, everything which you have already done in your 5 years of the medical college years. That's what it is. And what they want from you is that you should be competent enough and at the same level of what the trainees entering the second year of their foundation program of the UK. And the management of the long-term conditions, basically, which are seen very light touch with the primary care, but not at a very advanced duties, which is based of the general practitioner, because that comes in a speciality. But yeah, the light conditions which can be seen in a primary care, that can be tested in that exam as well. Many candidates ask me that how many, time required to prepare for the exam. It all depends on your medical background, your knowledge. If you have a career break, it might take longer. If you're just a fresh graduate, you might take 4 weeks to do it, honestly. And you can even give it during your house job. But yes, you cannot give it when you're in a 3rd year or 4th year like USMLE, because you need to have your medical degree MBBS completed before you attempt PLAB 1 exam. Looking at how the questionnaire or how the exam itself is contains about 180 questions, which comes from the medicine. A few you can get from surgery, peds, ENT, psychiatry and ethics, which is very, very important though, and which most of the different people coming from the other countries have not done it. Medical ethics is one of the very important core subject in UK medicine. And when we going back, I would say just go to the GMC website, print a PLAB 1 blueprint, which shows you all the percentages, what percentages of the different specialities usually come in the exam, because they keep changing. And you always have, for the update knowledge, you always have to look on the GMC website. So not a really good news for some, but I really think this kind of idea that they're replacing PLAB 1 soon to UKMLA, which is a UK medical license exam, just like a USMLE, that will be probably replace the PLAB in 2024 or 25. Why they needed to do that? Because what the GMC wants, they want to give patients and employers a great confidence when they're hiring the doctors that there's same level of knowledge. Because before that, the native graduates, they don't give any exam, and there was always issues that they used to see that what the medical knowledge they have, and they always used to be a comparison, to be honest, with the international medical. It always get tougher. So I think this is one of the exam which basically gives that unanimous medical knowledge, and nobody can question that. Every person who's coming to practice in the UK in the National Health Services will have a same kind of a knowledge before they're actually starting. So go to the GMC website. It has a lot of ton of really good information about PLAB 1 exam. This is just a screenshot from their website. It's absolutely, you get all the questions. And if you have any queries about the exam, just email them, contact them. They're really, really responsive, and they really quick in replying you as well. How we approach the exam. So there's always, I would say there's two approaches. Like I've seen my students going through this. Some prefer to read the notes first and then start solving the questions. And second approach is start solving the questions without reading the notes. So it all depends how you have always been preparing for the exams and what suits you better. Okay, so this is something, it becomes really difficult to prepare for an exam when there's internet is flooded with a lot of questions for that exam. It becomes so hard that which one works for you, which one's right, which is actually going to help me in the exam. What basically you need to do is you need to understand that the UK National Health Services and the guidelines are based on the NICE guidelines. Somebody has not. Can we mute that person, please? So the UK is basically, the whole practice is based on the NICE guidelines. Doesn't matter that which hospital you're working, every trust, every hospital follow NICE guidelines, and then a bit twinge and little hints can be a little change, but not much. So what NICE guidelines are, that is confusing because for some of us, because we were not exposed to these. NICE guidelines are basically an independent organization, the NICE, the National Institute of Health and Care Excellence. It was set up by the government in 1999. Its aim was to decide whether drugs and the treatments are available on the NHS in England. So what might be the practice, whatever the practice is in your country might not be the practice in UK. So the way you have to prepare for the exam, is based on what's the practice is in UK. You might be doing it in one kind of investigation in your country, and that might not be the right kind of investigation that they choose. You think that my answers is right. Okay, this person has come with a respiratory symptoms, and I'm going to opt for a chest X-ray first. That's what happens. That's what I've always been doing. I've seen in my hospital, in my country, but that might not be a practice. They might not just opt for chest X-ray straight away. So you have to follow the NICE guidelines. What's practice here, and the best way to read about the topics of the medicine is to go through the patient.info site. It is based on the NICE guidelines and everything you're going to, and most of the questions, let me tell you, they do come from there. Not exactly, but the base and the material, that would be the same. There's a lot of other question banks, and you can get some of the paid question banks as well, which is Pass Medit and PLABable. I am not really emphasizes on PLABable just because I work for them. I'm saying it because we cater, and the team cater the questions in a way exactly comes in the exam. However, the past medicine is basically just extensive knowledge that you get from medical knowledge and the notes, but question pattern, the way it comes, that more of the question bank resembles with the PLAB 1 is PLABable. Then comes your PLAB 2, which is a OSCE exam, and coming from whatever the background, whatever the country you're coming from, you have done your MBBS, whatever the medical degree you have done many OSCEs. So this should be a piece of cake, to be honest. It's never think that you need a lot of medical knowledge to pass this PLAB 2, because it all depends on your confidence, your kindness, and your communication skill. And in your home countries, if you're not kind enough to talk to your patients how the practice is, it will be difficult for you to pass this exam. This exam is all about your communication skills. And basically it's 16 stations, 8 minutes, 2 rest stations in between, and you need to pass 10 stations at least, as well as meeting or exceeding the pass mark for that day. So there's no one pass mark for this exam. It's based on the number of candidates who apply or who done the test on that day. So the pass marks based on that aims to reflect the real life setting, including a mock consultation. You can watch a lot of YouTube videos of the PLAB 2. It's really good videos there. They have explained how the stations run from the GMC. There's some GMC videos as well. This is your PLAB 2 screen. So one of the candidates was just agreed, gave the consent to share their PLAB 2 exam score sheet. So if you could see that in the score sheet of this PLAB 2, this person passed a minimum of 11 stations, which is a good number total. You need to pass a minimum of 11 stations, but this person passed about 17 stations. So exceed the number of stations he needed to pass and scored 1, and for the minimum score for the day was 109. So well passed. Then comes your GMC registration. Always prep yourself beforehand so you don't panic at the end. Always plan, and plan. So as soon as you fill all the form and make the payment and start doing the online general medical council registration and everything, as soon as you're going to pass the PLAB 2, the GMC will contact you anyway to get your registration ahead and do. So what you need to get yourself prepared with the scanned copies of passport, your MBBS degree, your certificate of good standing, evidence of your knowledge of English, no matter whatever test you have given, and the evidence of a completion of acceptable pattern of internship, which we call as a house job certificate, and employers' reference forms. So the General Medical Council usually gives you about 28 days to send all these documents. Otherwise, they will close all your application and send you a full refund. So you have to do in the timeline, and you can't go for any excuse. You will need to then start the application process again all over if you miss the deadline. The whole process of all these starting exams, from IELTS, from PLAB 1, PLAB 2, it's costly, but not as much costly as compared to you look at the USMLE, to be honest. And overall it does cost you about £5,000 to £6,000, involving your registration and stuff. But the good news is the discounted registration fee for the newly qualified doctors, you just have to pay 157. However, the ones who have a registration for the other doctors is basically who are not fresh graduates, they have to pay around £408. So just to sum up, you have to fill your online application, send your scanned documents to General Medical Council, wait for the GMC to process your information, and then you can book your ID check for the appointment. This is one of the website which is really good to go for how you're going to apply for the job hunting and the attachments. I'm not going to go through this. This is how the structures work in the UK. Once now you have got your registration, now what's a way ahead? What are you going to do? You're going to start applying for job, aren't you? So, and But I advise to all the international medical graduates, your aim should be, end of the day, to go to a training job. I know most of the time we have to start as a non-trainee job, but from day one, plan yourself and always keep in mind that your aim is to get this certificate of readiness to enter specialty training signed from one of the consultants you're working with. Because once you get that form signed, which is about a 9 to 10 pages, or maybe 11 to 12 now, and every year they change this form, which is called a CREST form. And make sure that from day one, when you start the job, your aim is to get this form signed from your consultant, because there's a lot of competencies in this form that you have to get it signed. So always work on that, and then you can apply for whatever the specialty that you want to go for. I particularly be highlighting on the GP training, and one of my colleagues will going to talk about IMT later. For GP training, you have to go for another exam, which is a multi-speciality recruitment assessment exam. This exam is basically it's very important for the employers and recruiters to shortlisting and assessment process of entry in training in not just GP training. At least now they have introduced like another 12 different specialities for ST1 and ST level: GP, radiology, ophthalmology, obs and gynae, neurosurgery, nuclear medicines, emergency medicine, and anesthetics, peds. All these specialities now want you to appear for this MSRA exam. So once you get your CREST form signed, it's very important for you to get yourself prepared and start studying for this exam as well on the side. So just a light touch on this exam, what it actually entails. It's a computer-based exam, and you give it in the UK in one of the centres, and I suppose you can give it in your home countries as well if you're just applying directly to a training program from there. It basically contains the two parts: clinical problem solving and professional dilemma section. So this exam have two parts, two mini exams, I would say. Clinical problem solving is all your medicine, and professional dilemma questions is the situation judgment test. That's based on your medical ethics, the good medical practice, which I think best time to give this exam is when you have worked in UK for at least a year, when you know the know-how of how the system works, what the ethics are, what the problems entails. Otherwise, it's just most of the IMGs who fail this exam is the one who doesn't have, and the most of the IMGs does fail professional dilemma sections, because our medical knowledge is always really great. Each speciality uses these results of the MSRA in a slightly different way, because they have their criteria of shortlisting in a different way, and they have their benchmark for all the listing, and they shortlist for the interviews, and you go to the selection center, and they have another OSCE after that and interviews. Once you're shortlisted, you pass this exam, you're shortlisted, then they're going to start calling you for the interviews. And never lose a hope, whatever the score nationally you are carrying there. Sometimes people leave, apply for the many specialities, and the speciality they choose, when they get that, they just their seats get vacant. So always be on the edge for this. So it also carries and makes up a part of the overall ranking when it comes from the selection center. So I know it's a lot of information in a really selected in a 13-14 minutes, but all I want to say is, whenever you're starting your career, always plan ahead things, because when you start giving a series of exams, it can be exhausting. And if it's not pre-planned well, then it becomes really frustrating. And you, despite having a good medical knowledge, despite having a good preparation, many of the IMGs, just with the stress, they just unable to do the exam or pass the exam. Here, I would stop my presentation, and I'll let my other colleagues to go ahead. And I wish you all the best, and good luck, all of you. And if you have any questions, anything that you want to send me over, I'm more than happy to answer. and all the best. Thank you.